So hi everyone, thank you for tuning in. I hope your day's off to a great start. My name's Emily and today I'm going to talk a little bit about pet therapy and dementia. So if you have any questions, feel free to ask at the end of the presentation and I hope you enjoy it. So I'm just going to start off by talking a little bit about the human-animal bond. So the human-animal bond is defined as a mutually beneficial and dynamic relationship between people and animals. So humans have benefited from this unique connection for thousands of years. And in fact, the human-animal bond has evolved for more than 15,000 years. And it began as a working relationship. So animals provided protection and service to people. This could have been while farming or performing other tasks necessary for day-to-day life. Dogs would track and herd, and cats usually lived outside and would keep the rodent population down, otherwise that could spread disease and damage food or other materials. Animals also served people during wartime, horses, dogs, carrier pigeons, and these animals not only provided protection, but they could also offer stress relief. So humans have benefited and animals are so essential to the daily lives of early humans that there's evidence that we may not have survived or even thrived without them. So anyone who's ever owned a pet or a working animal, I'm sure understands the special bond that we share, the connections we share with our dogs, cats, birds, horses, etc. It's very special. Our animals can sense our moods and they have the ability to bring a joy and a peacefulness that rivals even the closest human relationships in our lives. So there is scientific research that has demonstrated the link between human-animal interaction and healthy aging. So pet ownership is one of the most common ways that older adults interact with animals, and over half of adults over 50 have at least one pet. Many people have fond memories of a childhood pet or growing up on a farm, and research has shown that pet ownership can provide important forms of social and emotional support for older adults, and this can reduce stress, distress, loneliness, and improve overall quality of life. One study found that strong attachment to a pet was associated with less depression among older adults. The human-animal bond positively contributes towards healthy aging in several areas. This includes mental health, so in terms of lowering anxiety, depressive symptoms, symptoms of dementia, in regards to physical health, so improving cardiovascular health, decreasing obesity, and then overall quality of life and pain management. So in addition to pet ownership, pet therapy is another increasingly popular way that older adults are interacting with animals. So what is pet therapy? So pet therapy is a very broad term that's used to describe animal-assisted interventions. So that's an umbrella term that has many categories. So it encompasses any intervention or treatment that incorporates an animal in a therapeutic context. So in regards to health, education, or service for improved health and wellness. And this can include emotional support animals and service animals as well. So the first category of animal-assisted intervention is animal-assisted education. And this is goal-oriented, planned, structured intervention that's directed by a general or special education professional. So the focus is on activities that have academic goals to improve pro-social skills and cognitive functioning. It's often used in teaching and learning environments in classrooms, reading programs for children, and it helps to enhance student engagement, facilitate social and emotional learning. And so another aspect of animal-assisted intervention are animal-assisted activities. And these provide opportunities for motivational, therapeutic, or recreational benefits to enhance quality of life. So animal-assisted activities are delivered in a variety of environments by a specially trained professional or a volunteer. And they are generally the basic short meet and greet sessions of pets, visiting people in hospital or long-term care. And the same activity can be repeated with many people. So there's no specific treatment goals, and the visits can be as short or as long as necessary. And then the third aspect of animal-assisted intervention or animal-assisted therapy. And this is a more structured, goal-directed intervention in which an animal plays an integral role in the treatment process. So animal-assisted therapy is delivered by a professional health professional, and it's documented and evaluated within an individualized treatment plan. So it can help someone that's recovering from a stroke to learn to walk again, and has specific goals. And it's generally of a fixed length each session. So Most interventions are animal-assisted activities. So they start with someone who has a pet that they think would be suitable, and then they work with them for required training, and then they're able to start their career and have do their pet visits. Animal-assisted therapy, on the other hand, usually starts from the patient's perspective. So identifying the patient's need and then finding a suitable animal. So there are many different types of pet therapy and different animals that are used. So there's a very wide range of different animals that can be used, such as dogs, birds, horses, farm animals, fish aquariums, birds. So some nursing homes have animals that live at the facility, and others have people who will bring animals in to visit regularly for visits. And some communities also have programs where they'll bring in animals from the local zoo or petting zoo, and they'll include an educational component as well. So pets will only be used with patients who have no allergies or fear of animals, that don't exhibit any aggressive behaviors or have any infections. So animals used for pet therapy have to be up to date on their shots, well trained, and monitored to ensure everyone's safe. So some of the most common types of animal-assisted therapy that are currently available in Canada include canine-assisted therapy and equine-assisted therapy. So I'm just going to start by talking about canine-assisted therapy. So therapy dogs are used in therapeutic settings like hospitals or nursing homes, and they're screened for their ability to perform a specific type of therapy, and they're handled by professionals. So they're trained to provide affection and comfort to people, but they are different from service animals or emotional support animals. So there are three types of therapy dogs, three classifications. So the most common type of therapy dogs are therapeutic visitation dogs. So these dogs are usually household pets, and the owners of these dogs will take their pets to hospitals, nursing homes, or rehabilitation facilities to visit patients. And these dogs are used to improve the mental health of patients through socialization and encouragement. So for example, if a person with dementia previously owned a pet, these animals' interactions can really help with reminiscence. So visits from animals will help people with dementia to recall memories, and it can become an activity that they really look forward to. And there are also records of dogs that have visited care homes and taken naps at the residence, and this helps them to sleep. So it shows the importance of animal interaction in helping people to relax and reduce stress, and it emphasizes the importance and benefits of being tactile with the pet and what that can bring. So the action of just stroking the fur and being with the animal and their presence is very comforting. And animal visits also encourage exercise. So people with dementia tend to feel more inclined to get up and move when it means spending time with these dogs and spending short periods of time playing with them or going outside, or going on a walk. It can go a long way. And so another type of therapy dog is animal-assisted therapy dogs. So dogs that fall under this category have the duty of providing assistance to patients to reach certain goals towards their recovery. So they work to help patients gain skills such as motor skills, use of limb and hand-eye coordination, and they do this by walking patients through certain activities and games to help them practice these skills. So they're usually placed in rehabilitation facilities. And the last type of therapy dog is facility therapy dog. So these dogs usually work in nursing homes along with their handlers, and they live at the facility, and they help patients who have dementia and other cognitive and mental health issues. So therapy dogs must be calm. They have to be at least 1.5 years before they start their career. Able to walk on a loose leash, no jumping up on people. They have to be able to adjust to loud noises and fast movements, and be social. They go through obedience training, and they are different from emotional support animals and service dogs. I just wanted to talk about the difference between the two. So an emotional support animal is any type of animal, any species that can provide comfort to help relieve a symptom or effect of a person's disability. So they do not require any specific training. However, they do require a letter that's issued by a certified healthcare provider. So they're different from service animals, who are working animals, and they're individually trained to perform tasks that assist people with a variety of disabilities. So they're not pets, and only dogs are legally considered service animals. They go through 1 to 2 years of extensive training, and they have full public access rights. So now I'd like to talk a bit about how pet therapy is administered, or rather animal-assisted therapy, I should say. So it's administered by a doctor or a therapist that's managing the patient's treatment, and a trained handler that's often the pet's owner will take the animal to every meeting, and they'll work alongside the therapist to help the patient to reach specific goals. So there are many organizations that train and connect volunteer owners and pets with healthcare providers, and the animals are assigned for therapy based on the specific person's needs. So the first step will be in finding selecting a suitable animal, and then they will go through a process that typically includes a physical examination to confirm that the animal's healthy, an obedience training course to ensure proper animal control, an instructional course to teach the trainer about interacting with other people, and then they have an evaluation of the animal's temperament and behavior with the handler, and then they will receive a certification from the organization. So it's typically about a 6 to 8 week training process, and there are programs like the St. John Ambulance and Pet Partners that offer therapy dog programs and training. All right, so now I'd like to talk a little bit about the Dementia Dog Project. So this is a project that's been started in Scotland. It's a 3-year pilot project. And there's 2 programs, one in Scotland and one in Australia, and they're aimed to explore the practical, emotional, and social ways that dogs can help people to live well alongside dementia, both at home and out about in the community. So dementia assistance dogs are trained, and they're placed in a home with families where a person is in the early stages of the diagnosis, and they live with a full-time caregiver. So the dementia assistance dogs go through an 18-month extensive guide dog training, and then they're placed in the home, and they help their person with core needs. So supporting them with activities of daily living, helping them with exercise, balance, alerting them to hazards, environmental safety. They can even help to prompt them to take their medication. They offer support, so through companionship, they help them to build confidence and increase social interaction. And they'll stay with the person living with dementia while their caregiver's out, so it helps them to feel more secure and safe when they are alone. And the dogs are also trained to get the person home safely. So their collars are fitted with a GPS unit. So if the person doesn't give the home command, the device can help to track down the pair. So unlike guide dogs for people living with vision impairment, dementia dogs operate at the end of a 6-foot leash, and this allows them to most effectively steer their person in the appropriate direction. And so the Dementia Dog Project also has another aspect, looking at animal-assisted intervention. So this involves goal-directed visits from a dementia community dog and a handler who work alongside a healthcare professional, and they help people with dementia to feel more independent in their community and more confident and connected, and help them with things like taking public transit and just feeling more independent in the community. And they also have another program called Dog Days, which is a fun social group that brings people together. So it's for anyone at any stage of dementia that can come along and just enjoy the opportunity to interact with trained pet dogs in a dementia-friendly environment. So the pilot study, it's aimed to explore whether dogs can help people with dementia to maintain their daily routines, so helping them with their waking and sleeping patterns, their eating routine. It helps to improve their confidence, keeping them active and engaged, and also providing them a constant companion who will reassure them when they feel when they're faced with unfamiliar situations. So dementia assistance dogs are highly trained dogs with full public access rights, and they provide full-time support for families that are living with dementia. And there are dementia assistance dogs that are currently being trained in the US as well, in California and Tennessee. So next, I'd like to talk a bit about equine assisted therapy. So this encompasses a range of activities and treatments where persons are interacting with horses, and this is to help promote physical, occupational, emotional growth. So equine assisted therapy takes place under the supervision of a mental health professional and alongside a horse specialist. So in Canada, centers and instructors for therapeutic riding are regulated by CANTRA, which is the Canadian Therapeutic Riding Association. And the great thing about horses is they really pick up on emotions and behaviors of people, and they give immediate feedback. So they help participants to practice self-awareness and body movement control, and both verbal and nonverbal communication, and even helping them with range of movement. So the activities are not limited just to therapeutic horseback riding. They can also include grooming, feeding, haltering, and leading, and just learning about horse care and bonding with the animal. So some of the research that's been conducted looking at the benefits of equine assisted therapy in persons living with dementia have found that spending time with horses really helps to ease dementia symptoms, improves overall mood, and decreases behavioral issues. There was a study that was conducted with Ohio State University and an equine therapy center where they're looking at people living with Alzheimer's in an adult day program. They found that they were able to safely groom, feed, and walk horses under supervision. And this experience really helped to improve their mood and made them less likely to resist care or become upset later in the day. Behavioral problems were greatly reduced as well. And there's another research finding that found that there's an association between equine assisted therapy and improved balance and functional capacity in older adults with Alzheimer's disease. And another study was looking at promoting positive quality of life experience. So persons living with dementia in long-term care that participated in these equine assisted therapy sessions reported a greater quality of life experience. So it really helped to make them happy. So now I'd like to talk a bit about the benefits of pet therapy and how it can help people living with dementia. So there have been many studies conducted, and overwhelmingly the research supports the benefits of animals with people who have dementia. So improved mood is one of the most notable benefits, and it really can help, has a very calming effect in lowering blood pressure, cortisol levels. It helps to release endorphins, serotonin, and oxytocin, which is the bonding hormone, and releases a lot of feel-good hormones, which allows humans to really feel better, reduce stress, pain, and anxiety. It can help people feel more eager to exercise, participate in activities, to engage in treatment. Patients have requested less pain medication. During a medical procedure, people often have less anxiety if a pet is present. In rehabilitation as well, people are more motivated to recover and practice their therapy when they're working with a pet. So it really can help with increasing motivation, increasing physical activity, decreasing depression and loneliness as well. So I just want to talk about a few of the research studies in this area. So there was one study that was conducted in an adult day program with older adults living with dementia, and they found when they engaged in activities with therapy dogs, it really helped to decrease anxiety and sadness. It increased their physical activity as well, and positive emotions. Another study measured the effects of a facility dog on an Alzheimer's special care unit, and they found this really helped to decrease behavioral problems. So there was less challenging behaviors during the day for some of the residents, and it really helped to decrease agitation and aggression. And another study was conducted where they placed aquariums in a facility with Alzheimer's patients, and they found that this had a calming effect, and it really helped with residents' food intake. So food intake and weight actually increased over the period of several weeks, and it really decreased the need for nutritional supplements. So lots of calming effects. So now I'd like to talk a bit about companion animals. So most of the studies that have been conducted about pet therapy have been in long-term care facilities, but there's been research to show that there's the same benefits with owning a pet. So over 1/3 of older Canadians report living with a household pet that offers them companionship, and that can bring just unconditional love and acceptance. It can give people that are living with dementia some purpose and meaning in their life. It can really bring them comfort. Caring for a pet, feeding them, walking them. This can help provide a set routine in their day, an excuse to get out and exercise and interact with other people. Really provides companionship and greatly decreases loneliness, especially during this time. And both persons that are living with dementia and their caregivers can benefit from reduced physiological stress. So just by petting the animal, stroking the animal's fur, can have a huge calming effect. And it is best for persons in early stages of dementia when they're still able to look after a real pet, a real animal, which brings me to my next point about robotic pets. So they are very lifelike and realistic. They have built-in technology that responds to touch and sound so that they can interact with people very similarly to a real dog or cat. They're soft and cuddly, they can move, open and close their eyes, they have brushable fur. And there's been research done and has shown that they have a remarkable effect on persons in the middle and later stages of dementia. So they're not able to care for a real animal on their own anymore. This is a great alternative. It's very calming and soothing. It can help to decrease stress and anxiety and of course loneliness, and it gives them a sense of purpose and feeling that they're caring for something. And we're actually going to be starting a companion animal program through the Dementia Society, where caregivers will be able to request one of these robotic pets for their loved one, and they can pick them up on curbside pickup. So if you're interested in getting one of these for your loved one, you can email my colleague Jesslyn for some more information. And that brings me to virtual pet visits. So as I'm sure you all know, it's been a really difficult time for people living in long-term care retirement homes during the COVID-19 pandemic, not being isolated and on lockdown, not being able to visit family and to have those stimulating, engaging activities throughout their day. So it's been really hard. So virtual pet visits have really been providing comfort and bringing joy to seniors during the pandemic. And a St. John Ambulance Therapy Dog Program actually created a digital library of dog videos, and they started a YouTube channel to share them for all the residents to watch. So there are now over 100 videos there that are directed to residents in long-term care homes. And the videos range from comforting to funny. They include little clips of dogs going for walks, playing in the yard, doing goofy things, and it really brings a smile to their faces and brings them joy in their day, and it's awesome. And the response has been enormous, and it's just a great way to help fight social isolation, and it's a nice distraction during this really difficult time. Several long-term care homes have also been providing pet therapy to residents through the use of FaceTime, so they can still have their visits and see their furry friends. So now I just wanted to show a little clip from Sunnybrook Long-Term Care, Sunnybrook Veteran Center Long-Term Care, just to see what they're doing and the reaction of the residents.
Good to see you.
You can see us. With the whole pandemic, I think it's really pushed everybody to think differently.
This is Coogie. She's an 8-year-old Australian Labradoodle.
Cooch, can you say hi to your friend? You say hi to your friends? Hey?
So I would go to Sunnybrook every week and meet Jen downstairs, and she would come bring me up to the wing. We would visit, you know, in excess of sort of 20 different individuals. The vets that are there, both men and women. Average age is over 96, and they're amazing.
What you see is what you get.
When you realize how much is, because of COVID, how much is cut back up there, you know, their morning coffees, they're going downstairs to get something, none of that can happen.
We realized that the residents weren't allowed visitors, they weren't allowed to have the volunteers come in, that really their interactions were only going to be staff.
Within about a week or two, I sent Jen a note and said, what if we FaceTimed each other?
Hi, Jen.
How's it going, Mo?
We are here. We're ready to go. So who are we going to go see?
Little video visit with you, Mo, and Coogie. Coogie and Mo are on the screen here.
Hi, Georgie. We came to visit you through the screen, our little virtual visit to you.
Now, this is all very sudden and new information and new technology for the veterans, and including myself. I'm really proud of my veterans. They've really adapted well. It's been very difficult, but I think this is something different that they're allowed to see.
Oh, she's looking right at you.
Coogie's so cute.
I think you have to keep some form of normalcy through all this. You know, coming each week, there's something that the dog gives them, and it's amazing, and you see it in their faces.
Oh, she's giving me a kiss back, Georgie. That's for you. Big lick for you.
It certainly is great to have the dog in the building. Bye-bye.
Bye, doll.
Oh,
Come on. Big kisses.
I think for me, my favorite moments are when a veteran's having a bad day and they see the dog, their face lights up, sorry, and you know, you've made a moment, you've changed their day, you know, you've made them happy when they weren't happy. And I think for me, those are the favorite moments.
You made our day.
And mine. Okay, dear.
See you.
The dog is going to give you a kiss.
Love that video. So now I just wanted to share some resources with you all. If you're interested in getting involved for some programs, therapy dog programs, as well as therapeutic riding as well, equine assisted therapy programs in Ottawa and Ontario. So here's some resources that you can go back and check out whenever you'd like. I just wanted to say thank you so much for listening today, and don't hesitate to reach out. We're here to help at the Dementia Society. As dementia care coaches, we're here to support caregivers, families, and persons living with dementia throughout their journey. And we have support groups for caregivers. We have social programs for persons living with dementia and their caregivers to join and participate in their virtual right now. And education sessions as well to learn a bit more about dementia and how to help your loved ones. So don't hesitate to reach out. We're here to help, and hope you have a great day. Thank you.